Health Zone. I am Dr. Toju Chikiobi, but everybody calls me Dr. Toju. On today's episode, we will be talking about yellow jaundice. With us in the studio today is Dr. Efumbo Doseku, and she's going to be telling us everything that we need to learn about yellow jaundice. We're going to know what it is, we're going to know why babies get it, whether it's dangerous, what we can do to treat it, and what we can do to prevent it. So do come join us in this learning journey on the Health Zone. Welcome to the Health Zone. On today's episode, we will be talking about yellow jaundice, and with us here in the studio is Dr. Efumbo Doseku. Dr. Doseku is an amazing physician. She is the CEO of Outreach Medical Services, which runs two children's hospitals here in Lagos, in Festac and in Okota. Dr. Doseku, welcome to the Health Zone. It is a thrill to have you here with us.
Very happy to be here with you.
Thank you. Now, what is our usual custom here on the Health Zone is that before we plunge into the body of the discussion, we go out to the street and find out what the lay public knows about yellow jaundice. What is their understanding of yellow jaundice? So is it okay if we do that?
Yes, it is very important to know about the level of awareness
of the
public.
Okay, good. So we will go out to our Man on the Street segment now and see what the man and woman on the street have to say about jaundice. Don't go away, join us, and we'll be right back in the studio to talk with Dr. Doseku.
You're watching the Man on the Street segment of Health Zone. My name is Eyemi. Today we're going to be talking jaundice.
Well, jaundice is a disease that normally comes in children's body.
Well, basically, it's an illness associated with babies.
Jaundice, I think, children born with malaria.
It's all about eye problem.
Jaundice is a sickness that usually happens to children when their mom is pregnant.
For preventive measures parents should take up, should consider, I should actually advise our parents should probably pay much attention to their children, to their babies, so that when you discover things like this is associated with an illness that has to do with the liver. For me, it's not a child's play.
It depends on the mother. When the mother is pregnant, when she's pregnant, maybe if she's really careful about malaria issues.
We've been talking jaundice on the Man on the Street segment of Health Zone. We're going back to the studio now to listen to Dr. Toju tell us all we need to know about jaundice. Don't go away.
Welcome back to the Health Zone. On today's episode, we're talking about yellow jaundice in babies. And with us to talk about this is Dr. Efumbo Doseku. So Dr. Doseku, tell us what exactly is yellow jaundice?
Jaundice in babies is the yellowness in their skin, their mucous membrane, everything that is visible. It's actually yellow everywhere, but it's visible. And it's caused by a pigment called bilirubin. What is bilirubin? Bilirubin is a chemical or pigment that has resulted from the breakdown of our red blood cells. Most babies have a bit more red blood cells than an adult, and they need that so that when they're in the mom's womb, they can extract as much oxygen, because that is the function of the red blood cells.
Yes.
We need oxygen to live. So they extract the oxygen, and that is delivered all over the body, and it's used for energy, to break down, to create energy by breaking down food products. When a baby is born, the liver in the first 1 week is not very mature. The liver plays the role of breaking down this product called bilirubin. So it breaks it down, it transfers it between the liver, the gallbladder, and it's finally excreted through the intestine. It's further broken down through the intestine to another product which goes through the urine. So the body works in such a way that even this pigment or this substance that can cause harm will get, excreted or eliminated.
Yes.
Because it's important to get rid of it, because bilirubin, when it's high, is dangerous. Now, when is it a problem? Like 60 to 90% of babies will have a mild jaundice. So they call this physiological jaundice. They call this normal jaundice.
Yes.
It's just because the baby's liver is taking its time to get its enzymes ready. The intestines are taking time to work down, so the baby is being prepared. So it is all right to have mild jaundice. But the problem comes now. When the jaundice is severe, it stains all the tissues in the body, and when it stains the brain, it causes harm to some particular parts of the brain. And those parts of the brain are the parts that are responsible for movement.
Yes.
It also affects parts of the brain responsible for hearing and vision.
Are there some babies, though, that seem to be more at risk for this severe kind of jaundice?
Yes, they are. Now, jaundice, the causes of jaundice, we've talked about what we call physiological jaundice.
Yes.
So that is the normal jaundice. Now, but there are some things that make that jaundice abnormal.
Yes.
One of the main ones is when the father and the mother have a different blood group. The O positive baby in the O negative or the rhesus negative mother, it doesn't have to be O, because they have different types of blood group. We're talking
Yes.
about the rhesus now.
Yes. Mhm.
So the rhesus positive red blood cells, that is in the baby, that came from the father, can escape into the mother's system
During the pregnancy.
during the pregnancy. There's just one
Yes.
cord. It's an
Yes.
umbilical cord that links. So when this goes in, the immune system in the mother says, there's a foreigner in me. What is this? I'm feeling something. And the immune system will now develop antibodies. It doesn't know that it's a baby. It just says there's a foreigner in me. And those antibodies go into that baby and crack down. They attach to the red blood cells and crack it down. So as soon as, right from the time the baby is born, there is already jaundice.
Yes.
There's some other causes. Sepsis. What is sepsis? Sepsis is a significant infection in a baby. And I find that here the level of sepsis is a bit high. I think there are many things that are responsible for it. I think one of the things is that hygiene, personal hygiene,
Yes.
around the time when you are about to deliver has to be increased. And when you are pregnant, I think I've been pregnant 6 times, it can be quite uncomfortable. You're very heavy, everything, particularly towards the end. So you have to be careful. You must make sure you have good personal hygiene,
Yes.
particularly around the area of the female genital tract.
Okay, well, on that note, I want to ask you a question, but we'll take a short break. But I'll ask you so you can think about it
Okay.
for when we come back.
That's good.
When a child is severely jaundiced,
Yes.
how do we treat it?
Okay.
Hold that thought. Think about it. We'll be right back.
Yes.
We're going to take a break now, and we'll be right back to continue talking with Dr. Doseku about yellow jaundice in babies. Welcome back to the Health Zone. On today's episode, we're talking about yellow jaundice with Dr. Doseku. So, Dr. Doseku, before we went on the break, I asked you,
Yes.
how do we treat yellow jaundice in babies?
Okay. So when a baby has jaundice, the first thing is that we must give the baby adequate fluids, because if you give the baby adequate fluids, it will help to flush out this poison and the child will pass it through urine. So there must be adequate fluids. whether it's going to be, even for mild jaundice, I always say you should increase the amount of fluids you give the child. The next thing we could do, we could give the baby lights.
Yeah.
There's some special lights called phototherapy lights that help the mother to, they help the jaundice, they bring the jaundice levels down. So the babies are put in a cot, their eyes are protected because these lights can spoil the back of the eye called the retina.
Yeah.
If it's a boy or even a girl, the area, the gonad area, that where the private parts are, should also be protected because the lights can affect that. And the baby, the lights are put directly on top of the baby, and it's done on a continuous basis.
Yes.
The baby might have to be taken out intermittently to be fed, but put down on the lights. You know, if it's quite severe, you just put a tube, so you give the baby uninterrupted phototherapy lights.
Yes.
They are special bulbs. Because
So
again,
it's not just any light.
yes, because again, you know, any lights can help, but it's not effective.
Yes.
Because here I see they're using a lot of fluorescent, just ordinary fluorescent.
Yes.
The range, the wavelength that those give is really not the right one.
Yes.
They are supposed to use some blue lights, you know,
yes.
but blue lights are expensive. So what I try to say to a lot of doctors is, look, if you see jaundice and you don't have the right equipment, don't sit on it. Because if you sit on it and give poor quality lights, or if you tell the mothers go to sunlight, early morning sun, you know, there's a chance that if this is one of the children that is going to develop severe jaundice, that have wrong blood, different blood groups, has a bit of sepsis, there's a chance that it is going to get worse. And not a chance, it'll definitely get worse.
Yes.
Now, when it gets worse, and the baby now has symptoms, because jaundice is funny. I call it a silent killer. Because when jaundice comes, it doesn't give symptoms.
Yeah, the baby isn't crying or upset.
It just changes your skin
Yes,
color,
yes.
and the baby will continue feeding, maybe getting weaker, but you will say, oh, it's maybe next feed. When the baby has symptoms, that is when it is too late. That is when the brain is damaged.
So it seems to me, Dr. Doseku, that because jaundice, to start with, is a physiologic process that most babies get.
Yes.
And then some babies go on to develop severe jaundice in those situations that you described to us. It seems that what we need to do is to be testing these babies early. What is the international standards, the recommendation for when babies should be tested for jaundice?
You see, what is done, at least in somewhere like the UK, is that when every baby is born, they do what you call the cord blood.
Exactly. So the cord, the blood from the baby's cord
so
is checked
if
for
that
jaundice.
is raised, if it's more than 5, then you know that this one is a danger one. This one is going to have severe jaundice
let's put that one
eventually.
over here.
And then we start testing why is it like this.
Yes.
So those are the things that are done internationally.
Thank you so much, Dr. Doseku. What are what are the simple things an ordinary person can do right now to prevent jaundice? But before you answer that, we're going to take a short break, and then we're going to come right back. Okay?
Okay.
So we're going to take a short break now and come back and continue our conversation with Dr. Doseku about yellow jaundice in babies. Please stay with us.
Hours after her birth, I discovered that she was having yellow pigments all over her body, and she was placed under phototherapy lights. After 2 days, we discovered that the bilirubin level was not coming down, because at the first check, the bilirubin level was over 30. So we were a bit worried, and the doctor said he was going to have a second check on her. And after 3 days, we saw that the bilirubin still wasn't coming down. So we told them about our fears, and we were told that they were going to take her blood sample to another lab to have a second opinion about that. We waited for over 12 hours, and the result didn't come out. We decided on our own to go to another hospital. We discharged ourselves against medical advice, and by the time we got to the other hospital,
we were told it was an emergency situation, that having a bilirubin level as high as 30 was quite dangerous for our child, and immediately she had to undergo an exchange blood transfusion. So after the exchange blood transfusion, she had like three top-ups, I think, before she stabilized, and we discharged after about a week.
Okay. So Mrs. Popola, Adolua is almost 2.5 years old now. So what can you tell us about her development since she had that episode with the jaundice in the immediate newborn period?
Okay, when compared with my other two children, Adolua has a bit of delay in her developmental milestone, because up till now she has not accomplished most of her milestones. Like her neck control is not too good, though doctors say she's doing well for her age. Then she's beginning to reach out for toys now. She can only sit with supports, and for now she cannot stand. And she's making attempts at crawling. So compared with other children, growth is not, her development is not as rapid, as that of other children. But we've been made to understand that over time she'll be able to catch up with her milestones.
Welcome back to the Health Zone. On today's show, we're talking with Dr. Efumbo Doseku about yellow jaundice. So Dr. Doseku, what can the average person, the average mother, do to prevent yellow jaundice in their baby?
I think the average mother should, you must start thinking right from the time you're pregnant, and understanding that there may be a difference in the blood group between you and your husband, so at least submit it to your health care worker. Go and register in a good center with good midwives or doctors. When you have your baby, understand what everything labor is about, and if labor is too prolonged or if there's any problem, you must be able to reach out to them and ask questions. You must just lie quiet there and suffer. As soon as the baby is born, you must make sure that the baby is kept in very clean conditions. We must try not to use old clothes. If you're going to use the old clothes, because of, there may be some financial constraints, you must soak those old clothes for a few days in good detergent to get the camphor smell out of the old clothes. When the baby is at least 3 days old, when you go for your BCG, offer this baby to the health worker till as of the time our health system is more developed, and let them make a statement on whether the baby is jaundiced or not. If you're still worried, you can go to another hospital. Don't let anybody just throw you off if you're worried. Once you're worried, you must take it to its logical conclusion, measure the bilirubin level. So you go to a good hospital and they will measure the level for you, and you must go back again. Once you think the baby has significant jaundice, it has to be measured again. So those are the little things you can do, and make sure your baby has enough fluid. So you must work hard on breastfeeding.
Absolutely. What are some of the myths? I know there are a couple that jump to mind, especially when you were talking about the breastfeeding.
Yes.
There are a few myths out there regarding breastfeeding and jaundice, or regarding what to give a jaundiced baby. So can you just address those very briefly for us?
I think a lot of people give pawpaw leaves. So they feel that you must give the baby, they soak pawpaw leaves in water and they give the baby that, and they think that is the cure. Some other people will go to church to go and pray about it because they think it's a curse. Some other people will say it's a juju action from somebody, so they go to their babalawo, or they go to their, to some medium to get the curse out. Some other people feel that you should drop breast milk into the eyes, that will clear the jaundice. Some other people treat it as malaria. These are all myths. And, we have to be better educated, because like I said, we must work on the simple things.
Yes.
And jaundice is very simple to treat until it becomes severe. So it must never get severe. It is my prayer that through the Pediatric Association Nigeria and the Neonatal Association of Nigeria, both organizations will be able to help us, and we'll even be able to work collaboratively with our West African brothers on the right way to treat,
creating standards
and create standards, yes, for how to treat. Yes, I think that's quite important. I know it's going to happen.
I'm sure it will.
And,
I mean, you're passionate about it,
yes,
and I'm sure if there are enough people like you,
yes,
out there in the communities educating people about jaundice, I
Yes.
think we'll begin to see a difference.
Yeah.
I think so. So thank you so very much,
Yes.
Dr. Doseku. Thank you for joining us again
It's
on
my
the Health
pleasure,
Zone.
really.
I mean, if nobody ever knew about jaundice before, now they know everything there
about
is.
jaundice.
You've done
That's
such a
lovely.
great job teaching us about yellow jaundice, and we hope you'll come back again.
I'll be
and
very
join us
happy
on
to,
the
because
show.
I'm one of those Nigerians that believe in Nigeria. Nigeria is a very great country.
Thank you. We all believe. We believe that Nigeria and the rest of sub-Saharan Africa, we believe that we have a long way to go, but if we're doing it in a systematic and
way.
well thought out strategic way,
Yes.
we'll get there sooner than we think. So
I think
thank you.
I think so.
Thank you very
Thank you.
much. So that was yellow jaundice with Dr. Efumbo Doseku. We've learned quite a bit about it. And we're going to take a short break now and come back, and I'll recap some of the high points of what she taught us today. Don't go away. Welcome back to the Health Zone. On today's episode, we have been talking with Dr. Efumbo Doseku about yellow jaundice. And so I'm going to briefly recap what she talked about. Yellow jaundice is the most common condition requiring medical attention in a newborn, and every newborn develops yellow jaundice. However, it's usually mild and causes no problem, lasts a few days and is gone. However, severe yellow jaundice leading to brain damage is the most under-recognized cause of illness and death worldwide and in sub-Saharan Africa. Yellow jaundice that is severe can cause deafness, it can cause cerebral palsy, and permanent brain damage. It is important also that every newborn get their jaundice level checked between the day 2 of life and day 7 of life. It is critical, and this can be done either by a blood test or by being checked by a special bilirubinometer, or also by a trained professional looking at the baby. It's been wonderful having you here on the Health Zone. I have learned quite a bit about yellow jaundice, and I hope you have too. Do join us again as we continue to grow in our health knowledge. And from me, Dr. Chike Obi, I'm saying, please stay healthy.